So it's my great pleasure to take this opportunity today to speak with Professor Mark Jensen. Mark, it is great to see you. Very good to see you. So I think we met in Manchester at the European Society of Hypnosis meeting.
Yep.
And of course I've been to various seminars and workshops you've given around the world at various conferences. So what brings you to Scotland on this trip?
On this trip, I'm meeting with a colleague at the University of Glasgow to talk about pain research in general, not necessarily hypnosis research. But.
Okay. And so your background, for anybody who's not aware of the work that you do in Seattle, can you explain a little bit about what it is you do?
Sure. So my whole career really is to focus on understanding pain and learning about strategies to help people learn to better manage pain so that they can feel more comfortable and feel more in control. So of course naturally that led to hypnosis as a part of it, but I don't just study hypnosis. I'm interested in anything that will bring comfort to people and to empower them to bring comfort to themselves.
Excellent. So at what part of, I guess, your professional journey then did you come across hypnosis and start to study that? How did that happen?
So I was trained to use cognitive behavioral therapy,
okay.
Which evidences that it's effective, and I would provide that to patients, and they would say, Doc, I'm thinking better, I can function better, but I still hurt. Mm-hmm. Is there anything you can do to help me with the pain, because nothing else helps? And I would say, sorry, this treatment really is about how you think about the pain and how you can live your life with the pain. And that's how it was for many years, until I read a book written by Reynolds Price, who's a novelist. And he described having a chronic back pain problem and how he was able to turn it around by learning self-hypnosis. He said that in the book, he described how the pain was always there, but with hypnosis, he learned to take it from here and just put it here.
Yeah.
And he sounded like he learned something that the patients had been asking me for years to teach them to do. So I thought I should look into that. And then I wrote a grant. As a professor, we write grants.
Yeah.
And so I wrote a grant, and it was successful to give me a day a week for a year to study hypnosis for pain management. And Joseph Barber, who's an expert in using hypnosis for pain, lived in Seattle at the time.
Okay.
So I got paid him to do individual supervision. In the grant I said I would learn to do it. I would treat some patients, and if it was effective, I'd then write a larger grant to study it. Okay. And it worked for everybody. Not everybody had the pain cured, but they said for the first time I was able to reduce my experience of pain. And I was pretty amazed. I wasn't expecting that kind of response. So I was hooked.
Yeah.
And so I wrote the grant to do a study, and pretty much hypnosis is 70% of my research work at this point. And again, I go where the efficacy is and where the interest is, and it's absolutely fascinating to help understand what are the ways to deliver hypnosis to give people a chance to better manage their pain, and then why does it work, how it works. So it's been about 20 years now, that journey so far, and I'm still fascinated.
Indeed. It was actually a pain management case that really influenced my decision to further my education in hypnosis. I'd done the basic training course, and I treated this lady that had a chronic pain, and it just blew me away how effective it was.
Yeah.
And at that point, I then decided I wanted to study the masters and really learn as much of the science behind it as I could.
Yes. Yeah.
And as interesting as that was, it didn't really change the basic, simple techniques that you end up using.
That's right, and it's amazing how simple it is. It's amazing how simple it is. And it's something that's there for patients to learn and for us as healthcare providers to provide.
Yeah.
Easy to learn, easy to do, and the side effects.
Yeah.
People feel more empowered.
Yeah.
They sleep better. They feel more comfortable, lower stress. So the side effect profile is such that my current view is that it should be the first first-line treatment for any chronic pain problem. Doesn't cure necessarily, but virtually everybody gets some benefit.
And I think that, and it's mentioned, I will also want to mention your book. In my experience, I mean, pain obviously is such a complex, emotion. I mean, it's hard to even define, what pain actually is, but there's so much to do with expectation, motivation, experience, your moods, everything can affect it. And certainly through some of the work I've done with televised cases of patients undergoing what are quite traumatic dental procedures, having dental extractions, implants placed with no local anaesthetic. The main strategy we've had is relaxation, dissociation, but actually stripping away the emotional response to the pain.
That's right.
And kind of saying that there will be pain,
Yep.
and that cannot be changed, but you can change your interpretation of what's happening.
That's right. That's right.
And that's fascinating. So when I give lectures and we show the video footage of somebody having implants placed, when I ask at the end, are there any questions? There's usually a sea of hands of dentists saying, what would you have done if she'd felt pain? And of course the answer to that is, we are dentists. We're in that environment every day.
Yeah.
What happens if your patient feels pain? And you manage it.
Right.
You do something different and you help them.
That's right. That's what you do.
Exactly. So why would I now be fearful of somebody saying they find it painful? That's what I deal with every day.
Right.
So this is your new book, Hypnosis for Acute and Procedural Pain Management.
Yep.
Favourite Methods of Master Clinicians. I was truly honoured to be invited to write a chapter for the book. And it is literally fresh off the press.
Literally fresh off the press, right?
So I haven't completed reading the other chapters, but it is a fantastic resource. It really is.
Well, thank you. Thank you.
I take it as a bit of a labour of love doing something like this.
Absolutely. It's not something that brings a lot of reward in terms of financial, but the idea here is to find experts around the world who use hypnosis and to get an opportunity for them to teach their very favorite techniques in a certain area for clinicians to use it in other parts of the world. So the idea, my expectation and hope is that because this book and the series of books that we're doing are out there will just be less suffering in the world, just more comfort.
That's a very nice sentiment. That's
you.
Excellent. So this is the third in the series. So
That's right.
Am I correct in saying there's one for inductions?
That's right. The very first one, because hypnosis often begins with an induction. The very first book was about people's favorite methods of using of inductions in hypnosis. And what was fascinating about that was the variety of inductions people used. Yet there were very similar underlying concepts. And so there's room in this, as a hypnosis practitioner, to use whatever strategy you like. You can get there. And then the second book was on chronic pain, because that's something that's of particular interest to me. Third, acute pain. Fourth is General Techniques, a book.
Okay.
So it's titled Handbook of Hypnotic Techniques, and it's getting designed. The interior is being designed right now, this month. And then there'll be a second volume of hypnotic techniques, probably one on anxiety management, peak performance, general symptoms like sleep. It's endless. So there'll be many more titles than I have time to put together in the decades ahead.
but it's a fantastic idea, and the layout is fantastic. There's science and evidence and background and history combined with the actual techniques. And I think in your foreword, you said it's like attending a workshop by the individual practitioner.
That's how I asked, and I wanted to ask all the authors. So thank you for following the format and to do just that. To say, this is my thinking around this technique. These are the ideas. This is the reason I do it, and then to model it. Have a script or a transcript with commentary. So it's like we get to have an hour and a half, 2 hour workshop with Mike Gow to learn the technique that you're teaching, and then each one will have 10 to 15 different specific techniques.
And I think that concept of shading these things is so important. And some of the techniques I have in here, I've hopefully credited them appropriately.
Right.
It is quite difficult though, as you know, over the years you learn techniques, you adapt them, and sometimes you forget where did I get this from in the first place?
That's
did I
right.
invent this, or does it come from
That's
somewhere?
right.
And you
That's
kind
right.
of forget. I think most people and everyone I've met within the hypnosis world seems to share this sense of that doesn't really matter, and that if things are being used for the common goods, then that's okay.
And many of the ideas come from each other in our discussions at different meetings. So if something works, it'll emerge as effective.
Yeah.
And part of the idea behind this book, I'm a scientist by training, and a large part of my life is doing research to understand, does something work and why. But there are clinicians all over the world who see hundreds of patients, thousands of patients, and they've learned after 5, 10, 15, 20, 30, 40 years what works.
Yeah.
So that's a kind of evidence that people don't always get to share. And so part of what my goal here is to find those people, and if they need help them put the chapter together in a way that communicates it. So I take the editing very seriously, as you know.
Of course.
And so to get that knowledge out there, and so that's part of the fun of it as well. I get to meet wonderful people, master clinicians.
Of course. And I guess there's things and there's things that continue to surprise you and that you discover and learn that over the years, especially when you're editing. I think it just gives you this constant flow of new concepts and ideas, which is fantastic.
Yeah, absolutely.
Good. So what's next? Obviously, the next books. Your day-to-day work. How are you working? You're working with research then, as opposed to face-to-face with patients, or is it a bit of both?
For many years it was both, and over the years the research has taken more and more of my time. So that at this point I do, when I'm at work, I do virtually all research, but it's all clinical research. So we're designing different interventions, including often hypnosis interventions, and so I'm providing those to the subjects, but they're research subjects, yet they also have clinical pain or sleep or problems with diet management or whatever the issue is that we're studying. So it's a clinical work, but it's in the context of a research program. And so my time is spent thinking, writing, seeing subjects and participants, patients in clinical trials, and then as we get knowledge, sharing that knowledge around the world, both written and in workshops and talks and things. It's a wonderful job.
It is. And you're off to Budapest, is that correct?
That's right, going to a conference on New Generations Hypnosis Conference, organized by my colleague Kathleen Varga there in Budapest.
That'll be fantastic.
Absolutely.
And any other conferences on the radar? There's Switzerland, of course.
That's right, the European Society of Hypnosis coming up next year. And then the next International Society of Hypnosis is in Krakow, Poland in 2021. So every year there's workshops all around the world. And there's individual hypnosis societies who are putting on conferences and trainings too. So,
do you do training workshops in Seattle at all? Are you involved in any of the training?
I mostly travel to do workshops. So I do. That said, 2 weeks ago we just had a 4-day workshop in Seattle. But that was the American Society of Clinical Hypnosis.
It's strange how that happens. I'm kind of the same. I do talk in Glasgow occasionally, but it's usually further afield.
Yes.
Well, listen, it's been great chatting to you. This is the book. Please, go and have a look at it. It's on Amazon. One of the things that surprised me the most, I have to admit, when I went onto Amazon, was how great value it is. It was 20 quid.
Yes.
Yeah.
That's I want it out there, and I already have a job. So the idea is to get it out there.
Actually, it's £20. That's all. And, you can change people's lives for £20.
It's amazing. Yes, and it I think brings much more rewarding to the work that we do to see people get better.
It really does. It really does. Listen, thank you so much for taking the time to come and see me today.
Absolutely.
It's been a real pleasure. I even got my book signed, which I'm delighted. The geek in me is is thrilled to have a signed copy now. So thank you very much. Now before I do say goodbye, I did buy you a little gift. So I was delighted to hear that you do partake in occasional whiskey.
Occasional whiskey, yes.
So I bought you. This is a whiskey from the Glasgow distillery of Consultation.
Oh my heavens, lovely.
So that's our local distillery. It's just a few miles from where we sit just now. Unusual for Scotch whisky in that it's triple distilled, which is the way the Irish tend to make their whisky. But a very, very pleasant drink, and I thought the American oak was probably the correct one.
Oh, lovely! I'm looking forward to
you. So,
and we have some tablets to go with it.
You've got some tablet, fantastic. I'll give you a dental appointment after. It'll instantly decay teeth within seconds. But this is a thank you for the interview, but also a thank you for your work in the book and your guidance and support while I was writing my chapter, because I know. I was having a little difficulty at the time when I was writing it because of personal things that were going on, and I know I didn't meet all the deadlines exactly correctly, but your help got me there in the end, so I appreciate that greatly, and I hope you enjoy.
I'm already enjoying it. My future self is thanking you deeply. So
excellent. Listen, it's a real pleasure.
Thank you.